Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Heart disease is the leading cause of death in the U.S., and West Virginia exceeds the national average, with more than 14% of residents having been diagnosed with some form of heart disease. But it doesn't have to be that way. Today, we're talking about a heart health reset, how to prevent, slow, halt, and sometimes reverse the progression of heart disease. And yes, it can be done. Dr. Lakshmi Muthukumar, a cardiologist at the WVU Heart and Vascular Institute, is here to explain exactly how we can reset our heart health at any age. Welcome, Dr. Muthukumar, to Live Healthy West Virginia.
Thank you. It's a pleasure to be here, and thank you for having me.
Well, it's great to have you back. I appreciate it. So let's just start with exactly what do we mean when we say heart healthy reset? What is a heart healthy reset?
It basically means that you are switching to a healthy way of living, eating the right stuff, maintaining an ideal body weight, making sure you exercise at least like 30 minutes 5 times a week, making sure your blood pressure, your blood glucose levels, and your cholesterol are within the normal limits. That's what a reset means.
Okay. There's kind of a little method to this heart health reset. I've read about from the American Heart Association, Life's Essential 8. What is the Essential 8, and how does that apply to a heart health reset?
So what the Essential 8 means is, number one is eating right. So eating right would be eating foods like whole grain foods, avoiding fried, fatty foods, making sure, like the butter and cheese, trying to minimize it to a very minimal amounts. Eating a lot of lentils, legume, plant-based food, fresh fruits, vegetables, avoiding processed food. Number 2 would be staying active, as I told, staying at least like 30 minutes of moderate activity 5 times a week, so totaling up to 150 minutes a week.
Okay.
If you have a habit of smoking or vaping, that needs to stop.
And vaping can be just as harmful as smoking?
Yes, vaping is also harmful as smoking to the heart health. So vaping should not be a substitute for smoking at all.
Okay.
One thing people don't realize is sleeping adequately is very important for heart health. The AHA recommends at least 8 to 9 hours of peaceful sleep every single day to maintain a good heart health. Making sure you have an ideal body weight. The BMI, body mass index, has to be between 20 to 25. And your primary care physician or your cardiologist can make sure that your blood pressure, your cholesterol, and your blood glucose are within normal limits by either lifestyle changes or sometimes you have to be on medications. At the end of the day, these parameters have to be controlled.
Okay. Well, let's just dig a little deeper in some of these. I know you said that ideally we should get 8 to 9 hours sleep. I wish I could say that I got 8 to 9 hours sleep. It's usually more like 6 or 7. Does that vary with age, or is that for everybody?
For most people, that is what is recommended. But if for some, in 1 or 2 days you're not able to, if you can catch up, that's good. But making sure you have a restful sleep is what is important. Like, if you have obstructive sleep apnea, if you're snoring, if you're stopping breathing, you have to be screened and you have to be treated for it. And also, if you're very stressed, you probably need to get away from all your gadgets and TV, and, you should have a healthy, sleep hygiene is very important. Sleeping at the right time, making sure you wake up at the right time, that's very important for a healthy sleep.
And it makes a big difference, doesn't it? Sleep is really important to heart health. Why is that?
If you sleep less, you're very anxious. It increases your stress levels. Next day is very groggy, and your stress levels are very high. You're very anxious. If you don't sleep well, it can lead to depression. And anything that stresses you as a person is going to affect the heart.
Yeah, let's talk a little bit about that. How big of an impact does stress have on the heart?
Very big impact. So stress increases inflammation. Inflammation causes acute coronary syndromes, heart attacks, and so on going on. In addition, it exacerbates the atherosclerotic process. And stress also acutely, sometimes people have what's called tachycardiomyopathy. They can hear a shocking news, and their heart can suddenly weaken. And some people with medications it reverses, but some people it does not reverse at all. So stress has a very big impact.
Okay. And how big of an impact does diet have?
It has an enormous, gigantic, whatever you want to call it. So as what we eat, anything we eat in excess, even we think we eat the healthiest stuff, anything we eat in excess tends to accumulate. So it's very important, even when you eat healthy. I mentioned some of the healthy foods, like, foods rich in protein, and making sure your carbohydrates are whole grains. All that is important, but anything in excess is not important. So it's important you read the labels. And even when you eat something which is unhealthy, make sure you eat very less amounts, like count your calories. That's going to help you. Like
Okay, so count your calories. What about in regards to maintaining a healthy weight and even diet changes? What about GLP-1s? I mean, that's very popular right now, and I understand there are some studies where, is it true that GLP-1s can help heart health?
Absolutely. So GLP-1s have a direct and an indirect effect. So the direct effect is GLP-1s help with weight loss. They help better control of your blood sugars. Both the weight and the blood sugars are directly related to the heart. In addition, for some unknown reason, there are 400 trials right now going on with GLP-1s.
Wow.
And they are also, irrespective of the weight and diabetic control, have a direct effect on reducing the heart inflammation and the adverse effects that happen in the heart. So GLP-1s are very useful. And if you especially have obstructive sleep apnea, if you're a diabetic, it gives you additional help. And even if you already have a heart attack or you have some kind of a heart disease, like heart failure, if your heart is weakened, GLP-1s have shown to have a beneficial effect on the heart directly.
What about coronary artery disease? Is that considered part of heart disease?
Absolutely. So heart disease, coronary arteries are the arteries supplying blood to the heart. They bring the glucose, oxygen, and so on. So anything that's going to compromise the blood supply to the heart muscle, that's when you get a heart attack. If it blocks off or it slowly builds up, then you're compromising the blood flow and you have chest pain.
Yeah.
If it acutely breaks off, if a plaque acutely breaks off, that's when you have a massive heart attack. And so the coronary arteries are very important to provide. Coronary arteries are the ones that actually give blood supply to the heart.
So we should know numbers like what's your cholesterol and what's your blood pressure, that all applies to heart health, right?
Absolutely. So let's talk about blood pressure.
Okay.
Blood pressure, you have two numbers, the top one and the bottom one.
Mm-hmm.
So the systolic and the diastolic blood pressure, 120/80 is the normal blood pressure. So we need to have a blood pressure less than 120/80. If it is between 121 to 129, I know these numbers are there, it's called you have elevated blood pressure. Then if you're above 130, you have hypertension. So it's very important to make sure you check your blood pressure with a cuff at home. And also, when you go to a primary care or your cardiologist, make sure it's calibrated so that your cuff at home is not erroneous. And so every time you see your primary care doctor, they would check your blood pressure, and if your blood pressure is elevated, they would start putting you on medications. Yes, meditation, yoga, all this helps to reduce your blood pressure. Weight, if you lose the weight, you can come off blood pressure medications or at least decrease the dose of the medications. So people who are overweight tend to have high blood pressure issues.
Are there foods that can raise blood pressure? Like salty foods or?
So, yes, salty foods. So, processed foods, we have to talk about processed foods, sausages and processed foods and pickles. And, when you go to a restaurant, there's increased salt added to the foods. The reason, to make it taste better, sometimes they throw in increased salt. So anything which increase, that's why watching the labels, even when you eat certain types of packed foods, making sure you watch the labels to see how much sodium is in it is very important. Because when you eat excess salt, yes, your blood pressure can go up, but also if people have heart failure, it can exacerbate an episode. So it's very important to watch your salt intake.
Okay. Wow, we got a lot to keep track of here. What about managing blood sugar? Why does that help heart health?
So, when there's elevated blood sugar, that's when you have diabetes, right? This elevated blood sugar, what it causes is it increases the inflammation. It also exacerbates the atherosclerotic process. We were speaking about the coronary arteries and other arteries supplying. The arteries are the ones that carry blood to various organs, and when your blood sugars are very high, it causes atherosclerosis. The plaques can build up and it can lead to obstruction of the vessels. So when blood sugars are very high, it can affect almost every part of your body, starting from your eyes. You can have increased risk of stroke, your heart, your kidneys are affected. So controlling the blood sugar is very important if you are diagnosed with diabetes or if you're a pre-diabetic. That's why we check any patient who comes into us for a primary care visit. We always check what their hemoglobin A1C is, because that tells us what the blood sugar has been running for the last 100 days. So we check their blood sugars. If they are in the pre-diabetic range, we start them on medications to prevent or to push the diabetes a little longer before they can be diagnosed with diabetes. If they are diabetic, we start them on medications. And if their blood sugar, being a diabetic, if your blood sugars are way out of control, that's when, we start them on GLP-1s. And, there are so many diabetic medications out there also out in the market, which either their primary care, or if they're too complicated, they refer them to an endocrinologist who can take care of it.
So both diabetes and high cholesterol contribute to coronary artery disease, those plaques building up.
Absolutely. In addition to high blood pressure. So high cholesterol, blood sugars, and high blood pressure and stress, all this contribute to development of blockages.
This is quite a list. Now, I'm sure there are some people like, I want to get started on my heart health reset, but I think there are some that might be intimidated by all of these changes. What would you say to someone that might feels like, oh, you know what? It's too late for me. There's too much wrong with me. This will never work for me. What would you say to those people?
It's never too late. It's never too late to start. You have to start small. Even if it is going to be that, okay, I'm going to start including like a healthy diet, like I'm going to eat one more serving of fresh fruits or vegetables, or I'm going to give up processed food. You start small. And then even if it's during your lunch breaks, you're going to say, I'm going to take a 15-minute brisk walking, even if it's going to be wherever you're working, like I'm going to stop and start small, follow a routine. So it has to be like, okay, I'm going to do it before work, during my break, or after work. Stick to a routine. Start small. And I tell my patients, like, even you start with 15 minutes every day, subsequent week or subsequent month, increase it by 5 minutes. So next month, you can, or next week, depending on your time and everything, you can increase it to 20 minutes and slowly progress it to 30 minutes. If losing the weight is not possible on your own, that's when, seek help. We have the clinic to help you lose the weight. We have the nutritionist. So we have resources that you should make use of if you can't do it on your own. If you feel intimidated, you're never going to make the change. You have to break it and say, I'm going to seek help. You have to start doing something about it.
So baby steps. Start with baby steps. Reachable goals.
Exactly.
One at a time, and just add to them as you go.
Mm-hmm.
So following these essential weight, can this really, I know it probably can slow the progression of heart disease. Can it stop it or even reverse it?
It is possible, with age, you're going to have changes done to it. So definitely following a healthy lifestyle, the ones we mentioned before, is definitely going to slow the progression of WIST. As far as reversing, yes, there are some conditions that you can reverse. So earlier it is, the better it is, but it's never too late. So sometimes there are plaques that build up which have not calcified yet. And when you control your cholesterol, blood sugar, and blood pressure, there are studies that have shown some kind of regression of them. So, and that's why it is so important, because timely help is not just going to slow the progression of the disease, but also it can prevent permanent damage. And that's why we ask people, when you have chest pain, don't make the judgment for yourself. Seek help, because you don't want it to be too late when the muscle is dead.
Yeah.
It is dead. So you want to seek help when you start having chest pain, rather than just brushing it off, saying this was gas, this is my stomach, this is my hormones.
Yes. So you should be skeptical.
Exactly.
Yeah. I wanted to talk a little bit about the advancements in treatments and medications for heart disease over the last 5 years, the last 10 years. It just seems like it's exploding. Like there are so many more better treatments, minimally invasive treatments and medications. Are we really on a progress train, for lack of a better word here?
There has been exponential growth, not just with medications, but with technology to detect the diseases, and also technology that's helping minimally invasive procedures. So, valves are now put in through percutaneous approaches. They can go through your groin and put a new valve in, so they don't have to cut you open. The patient gets home the next day. And there are, even when you need to be cut open, you can robotically do it now. So with minimally insertion, so the recovery is a lot quicker. And also when you have heart failure, or when you are having a heart attack, there's so much medications that have come out that which makes people feel dramatically so much better. Like I have patients who I sometimes put them on Jardiance or Farxiga, and in about 2 weeks they come back and tell me, oh my gosh, I feel great. And their quality of life improves, just that they can see it, we can see it. And some of these medications have actually also shown to reverse their heart function.
Wow. Wow. That's good to hear. So there's hope. Sounds like there's a lot of hope.
There's a lot of hope. You just have to seek attention, seek help. Seek attention meaning like seek help. So I think it's very important to talk to your doctor when you start having, you don't have to make the decision. The doctor can tell you what are the next steps to be done, and we can go from there.
Wow, that's great. Can you talk a little bit about the level of expertise of the cardiology team and the entire team at the WVU Heart and Vascular Institute? I mean, we're really lucky to have this here in West Virginia.
The WVU Heart and Vascular Institute, we have expertise in terms of we have the expert physicians who can treat these conditions minimally invasive. We have preventive cardiologists. We have a lipid clinic for people whose cholesterol is very difficult to control. On the other hand, once they have the disease, we also have people and technology to do these minimally invasive procedures so that their recovery can be quick, their hospitalization can be minimized, and also we can prevent recurrent readmissions because we have rehab, which, patients who undergo open heart surgery or who've had a heart attack go through rehab. So we are trying to take care of them before they have an event, during the event, and after the event, so that they don't have readmissions, or we're preventing a secondary event from happening.
Yeah. Wow. And it's right here in our front yard.
Exactly.
And you don't have to leave the state to get excellent health care.
No, you don't have to leave the state. We have all the latest equipments and physicians who are trained in the latest technology who can take care of it.
Just getting back to this essential 8, and, you're saying take baby steps, where's the best place to start? Of these 8 things, what would be the most impactful place to start? Like, I would just guess it would be quit smoking and vaping, but maybe I'm just I'm not a doctor. I don't know.
Absolutely. Quitting smoking and vaping, you have to stop it. However, in people who are addicted, it is not easy.
No.
So we do have resources for smoking cessation. Talking to your primary care doctor or your cardiologist who you see that they can give you some resources. They can help you with prescription of the nicotine gums, patches, and those to prevent. And also following a healthy lifestyle, including a diet, as I said, knowing what are the healthy things to eat, what you can eat on, or just starting to watch the labels is going to make a huge impact. Even if muffin is not good for you because it has a lot of white carbohydrates, I'm not recommending, but say you want to eat a muffin, just look at how much a small muffin calories has.
Oh, yeah.
So look at the label, and then you're going to cut yourself, oh my gosh, I want to just take 100 calories, so you probably have to just eat 1/4 of the muffin.
Yeah.
And because it's loaded with sugar, it's loaded with
all
white,
the bad stuff.
all the bad stuff, right? But on the other hand, knowing that one whole muffin, how many calories it carries, is going to help you.
So would you say that diet and quitting smoking are the most impactful first steps to take?
Absolutely, diet. And I would also say, just get up from the couch. So just, get yourself out from the couch. Even if you're watching a favorite episode on the TV, there are now very small machines that you can just do a biking, just put it in a front. You can take it wherever you go. And
That's
some people
right.
have it at the desk at work. They have movable.
I've seen them.
Yeah, exactly. And some people just have it in their living room, and they just keep. So all you have to do is you have to keep moving.
Yeah.
Just don't sit. Just move. Or if you can, as you watch, if you want to do some stretchings.
Yeah.
Something to keep moving.
There's a lot of options there.
Exactly.
So just before we go here, I always like to ask, what's the most important thing you want our viewers or listeners to know about starting a heart health reset?
It's never too late. It's never too late. Start with baby steps. And both men and women, it's the number 1 killer, heart disease. And the reason that women tend to seek help late is because they have some they do have chest pain. They have some associated features with the chest pain. Sometimes they have back pain. Sometimes they start to panic, and because of the pain, they don't know how to respond, which makes them think that it is something else. It's a panic attack. So when you are having chest pain, take it seriously. It is not your job to find out what's causing the chest pain. And that's why I think I have a white coat to figure that out. So I think it's important to seek help.
Take it seriously. It's better to err on the side of
Of
caution.
course. Exact. Safe than sorry. Absolutely.
Yeah. All right. Well, thank you so much for all this helpful information. We're ready to start now. It's, we're a little bit into the new year, and, it's a good time to do a heart health reset. I'm ready anyway.
It's a pleasure. Thank you for having me again.
Thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about heart health, visit wvumedicine.org/heart. And to find the latest episode of Live Healthy West Virginia, visit our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist. Or just search WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Muthukumar and everyone at WVU Medicine, thanks for joining us.